The clinic is located on the third floor of the Lim Hong Koo Medical Arts and Wellness Center. I decided to get a treatment to boost my immune system against the COVID-19 virus. But first, I had to register my personal information, my medical and surgical history, and any medications that I may be taking.
Hello. Hello. So, so friends, I'm here today at the Point of Care Acupuncture Clinic, and the one running this clinic is no other than Dr. Jefferson Ong, my classmate, and also recently the Bohol Medical Society president. So this will be my first time undergoing the acupuncture, and the purpose for this is to boost my immune system and improve my concentration ability. So say hi to our viewers. Hi. Okay. So before we start treatment, I would like to ask a few things about acupuncture. So my first question is, so how did you get started with acupuncture?
From medical school, I decided to do a little bit of general practice, and then in the course of general practice, I realized that people came in for patients came in for consult mainly for two things.
Okay.
Number one would be pain. Second would be a growth or a tumor. Okay, so they're especially afraid if they see growth, and then they're also afraid if they feel pain. So I decided to target on pain. So I tried to look for specialties that would deal with pain, chronic pain or acute pain. So the default would be anesthesia. Okay. But I didn't like the use of drugs. So I eschewed the use of medications, especially the pain ladder, when you have to escalate from one drug to another until you find relief. So I did some reading and found that acupuncture is one of the modalities used in pain management. And it amazed me because I knew acupuncture as part of traditional Chinese medicine. So I decided to ask my cousin in China to help me do an observatory rotation in one of the traditional Chinese medicine hospitals. And well enough, in my grandfather's hometown, there is a big hospital for traditional Chinese medicine. It actually caters to patients all throughout Southeast Asia. So the exposure to various cases and methods was actually quite good. So after maybe a few weeks of observation, I decided to enroll because they have a special course for doctors. So they didn't need to like educate you on anatomy, physiology no more. No? So it was more on acquainting you to traditional Chinese medicine, the principles of traditional Chinese medicine, and then you get to see several patients in a single day. So that particular experience led me to actually get into the field. So I came home after 3 months of immersion in China, and then decided to get into the practice. And actually, it is a very fulfilling specialty in a way that you see results. You get to help people who are desperately in need of relief, for which modalities in Western medicine, the main ones are medication, pharmacological based therapies, and the second would be surgical. or other types of interventions. Um, these modalities sometimes they fall short, or they are too drastic, or there are no available medications or procedures that can safely relieve certain illnesses. For these particular types of diseases or disorders, acupuncture has a role.
Okay.
So we found out that it has a role to play in almost every field of specialty. So it's a very flexible type of therapy.
Okay, second question. What are the benefits of acupuncture?
Benefits of acupuncture. It's a very broad thing, no? Because there are various applications for acupuncture. Number one, okay, if you don't have complaints, if you don't have symptoms, you're not feeling any discomfort in the body, or you have not been diagnosed with any conditions, acupuncture is actually useful for maintenance of well-being, because it does not only work when you have a disease, but actually its role is more on preventing complications from a disease. That is I think the most important role is prevention. It restores the balance in the body. Okay. Actually, we don't just talk about the body. In traditional Chinese medicine, we consider the human being as a whole unit, body, mind, and spirit. So you have to consider all three when you are treating a person using traditional Chinese medicine or acupuncture in particular. So when you're doing acupuncture, you're actually preventing, okay, complications from an existing condition. You're also preventing the onset of conditions based on the imbalances already existing in the human body. You know? For example, you have a person who has anxiety problems. Okay, anxiety is connected to the earth meridian, or the earth element in the body. So if you're going to prolong the person's exposure to that kind of emotion, he will eventually develop bodily symptoms. So the first organ will probably show signs and symptoms for as a result of anxiety would be the stomach. You will have gastritis. Sometimes there's a loosening of the gastroesophageal valve or gastroesophageal sphincter. You know? So the weakening of that will cause reflux. You know? So that is just an example. You know? So you have to prevent the cascade, you know, from emotional or from a bodily injury. You have to prevent the cascade so that it will not become a chronic illness or a terminal illness for that matter.
Are you ready?
Okay.
My third question is, how does acupuncture work?
Okay. The basis of the therapy itself, acupuncture, is the principle of the meridians or the energy channels of the body. As you can see here in this doll or this model, the body has lines. You can see the lines here, and these represent what we call the meridians or the energy channels of the body. Okay. Now these meridians, they connect with the organs inside. Okay, but their appearance or their presence on the surface of the body or near the surface of the body makes it convenient for us to stimulate the organs using these connections. Okay. Now the principle here is also an integral principle, is the presence of energy, which is called qi in Chinese. Qi is like vital energy. It's produced by your cells. It is almost like electrical energy, but it can also manifest in other forms, like heat, okay, and Coldness is the opposite, like a draining of the energy will manifest in coldness or numbness. So the qi is important in traditional Chinese medicine. It is the basis for the function of the body. In fact, the flow of the qi is also related to the flow of the blood, the flow of the lymph, and the function of the nerves, impulses. So in a way, when we do acupuncture, we are stimulating these various networks in the body. The nervous system, the circulatory system, both arterial and venous, and then the lymphatics. Okay, let's go to the objective of the therapy is to harmonize. Now, the objective of the therapy is to harmonize the functions of the various organs. Okay? Because there is a tendency for an organ to overwork, or it tends to overpower a certain the other organs. So it causes the weakening of the organs. It drains qi from other organs. At the same time, it overproduces its own products. So you will have an imbalance that will lead to disease. Sometimes an organ can become very weak. If you have primarily if the pathology is, or the cause of the disease is draining of the qi or draining of energy, then that organ becomes weak. It is unable to control the other organs or balance the other organs. Then you also have disease or a disorder. So practically that's how it works. Applying the needles on these points along the meridians will help to stimulate the particular channel. It will help to ease the flow of energy. In that way, you restore harmony.
My fourth question is, how many sessions should the client get to gain the full benefits of acupuncture?
Okay. There is no single answer to that question, because the number of sessions will depend on the condition. Okay, there are some diseases that will require continuous therapy. That means that the patient will have to come back every now and then, not necessarily frequently. They can come periodically to restore the balance of the meridians, or to, let's say, like maintain the relief afforded by acupuncture. So in the immediate phase, if there is pain, if there is current very severe symptom, then you may have to see the patient more frequently, as frequent as twice a day. You have to do the therapy. So that one is usually for people who have extreme pain, intractable pain, or people who have severe symptoms. Not necessarily pain, but it could be swelling, could be a seizure. So you might have to do it more frequently, or you may have to see the patient more often. So the number of sessions will be until the person is relieved, or that the condition is resolved.
So fifth question, at what age can someone get an acupuncture?
Acupuncture treatment can be given to as early as newborn. It can be given to somebody as old as any human can get. So it's very flexible. It's also relatively safe if it is applied correctly, if it is done by properly trained acupuncturists.
So my last question, are there any contraindications to getting the procedure?
I think the only contraindication for acupuncture is when the person is dead.
Okay. I'm asking this question because it might give me some hope now. So, can acupuncture help me regrow my hair? Because I'm having a bald spot. Maybe
Okay.
this could help. I'm just trying.
Well, baldness, pattern baldness, we call it alopecia, alopecia areata in medical terms. That is traditional acupuncture may have some sort of therapy for that, no? But largely in modern application of acupuncture, we have not seen uh, as far as kind of well-researched, no, well-researched mga applications, we have not seen it to work. Okay, so I'm very sorry, Julie, but scientifically I cannot vouch for the use of acupuncture on baldness. However, if you're going to get the therapy, if you're going to try it out, then we will be using a lot of scalp points. No?
Okay.
So who knows? It might help to stimulate your hair follicle.
Hopefully, hopefully. So that was a very informative interview with Dr. Jefferson Ong. Now I'm ready to do the acupuncture.
The most important diagnostic skill is the pulse. Okay, pulse diagnosis is important. Now the pulse is divided. Each side is divided into 3 segments. Each segment represents a meridian or an organ. So on the right side, we are feeling for the lung meridian, followed by the spleen, okay, the blood-forming organs, and then kidney. This is kidney yang. So this is the warm energy produced by the kidneys. So the characteristic of your pulse is medyo erratic. There's a strong pulse, and then it's combined with a little rapid, pero it's sunken. There's also a sunken part, especially sa yung lung segment. You are right if you're thinking that your immune system is challenged. Yeah. Kidney pulse is also a little weak, so that has something to do with your maintenance medication. That's consistent. Right? That's consistent in those people with medications, especially for hypertension. It affects the quality of the circulation. Liver. The liver pulse is good, well balanced. Kidney yin. It's better than the other side. So it's really your kidney yang. The warm side of the kidney is a little down. So that will also follow your spleen and then your lungs, but especially the spleen. The lungs are very much affected. So what have you been feeling? You've been studying
Yeah.
Go ahead.
This is a point along the kidney meridian. This one. And the kidney meridian starts here, the bottom of the foot, going up. Then you stimulate this part of the stomach, So the stomach meridian is a yang meridian. Okay. So it's a hollow organ. So we call it a fu organ in Chinese. So fu organ is a counterpart of a yin or a chang organ. Okay. Chang organs are the solid ones. No? We have the liver, the kidneys, the spleen, okay, the lungs, and the heart. Okay. So those are the 5 chang organs. And then we have the corresponding hollow organs.
So the,
It's okay. Okay. So this one is large intestine point. Okay. Very useful for fever, for pain, and for the immune system. So if you have somebody with fever of unknown origin, you don't know kung saan na siya, combined with other symptoms for that matter, this point is very useful. So there are 2 points actually along the large intestine meridian which are very useful. Easy to access, easy to learn. I will show you the other one here. This will also help with inflammation. Strangely enough, my fascination with acupuncture when I observed this in China was how much they use this point, even for children with asthma. They're having an asthma attack, then they just use this point on both sides. After a while, they didn't give anything else. No oxygen, no nebulizer, no nothing. Just 2 points. They leave the patient there. After mga 15 minutes, that's shorter than nebulization, right? And nebulization from 30 minutes, or more. No, really siya.
As in totally?
15 minutes.
Oh.
I was bringing my stethoscope. They didn't have stethoscopes in that hospital. It's traditional Chinese medicine, no? Pero I brought my stethoscope. I listened. Oh, wheeze. And then pagbalik ako, wheeze.
Wow.
So, wow. How did that happen? Now, there's a component of acupuncture therapy that we call Tao Yin. Okay? Tao Yin is like the way, your habit, or what you do along with. Because the stimulation of the meridians is only one part. There's also a part of the patient when you have to participate in some way. So one is lifestyle change. You have to be serious about it. Change your diet, you watch out for what you're eating. 0.25 millimeters.
Very small.
So 0.25 millimeters. Ang mga lens nila mag-vary lang kung saan yung ibutang. So we use a longer needle for fleshy areas, for fatty areas, and then you use shorter needles for example, the head. Those are short needles. There is more bony areas, short needles.
So there are 7 needles inserted to me right now. 1 on my left hand, the second and third on my right forearm, a fourth on my left leg, and a fifth on my right ankle. I have 2 more needles on my scalp, but I won't show it because I'm shy. I always imagined the treatment to have several needles inserted into the body, but Dr. Ong reassured me that this was just for cinematic effect in the movies.
So I'm done with my acupuncture. The whole session took 30 minutes. It's time for push-ups.
Action.
So, doctor, thank you for doing the acupuncture on me. And,
How was your experience?
I feel good. There was no pain at all, just a tingle. And I feel there's already change, especially when I did my push-ups. I feel lighter and stronger. And I feel well rested. It feels my energy is freely flowing. And I look forward to another session with you. So,
Our pleasure.
thank you.
Accommodate you and continue your good health.
Thank you. So, Dr. Jefferson Ong, the only acupuncturist here in Bohol. You could reach him on his Facebook page. He has a Facebook page, Point of Care Bohol. And also, you could Google him and set an appointment. So, thank you.